Good morning, everybody. My name is Yodaisy Llorente. Today I want to talk about the line injuries. Okay, do you know what is the probability that you receive a line injuries? The probability is like the winner lottery. It is one but that 750,000 persons receive a line injuries. Okay, how can you prevent the line injuries? It is easy. If you planify to go outside or to a party, you need to check the weather first one. Okay. During another form to prevention is during the storm, don't run and don't use wet clothes. Turn off your cell phone because the electromagnetic radiation can attract lightning. Never take refuge under the tree. Another is avoid contact with lake, beach, or pool or river. If you are in the storm, you can use this position. Okay, I want to mention a curious note. In January 2014, in Mar del Plata, Argentina, was the beginning a typical summer storm, and young people died. 4 young people died, and 20 received an injuries. One of them was a serious gravity too. And I want to mention Roy Sobijan. He is a famous man who received a 7-line stroke. It's very important to prevent the line stroke. Why? Because in the case that we live in Miami, the weather is hot and sometimes it's raining, and you are talking by the phone, or you are in the pool, and we need to prevent that because it's a serious problem. Thank you.
Good morning, my name is Maria Enriquez. I'm going to talk about the frostbite in a person that is exposed to frozen temperature. Frostbite is a injury caused by freezing on the skin, on the light tissues, and is most commonly in the part of the face, in the lips, in the nose, and the ears. It's classified by degree of severity. First degree is characterized by partial skin freezing, erythema, and lack of blisters. Second degree is full thickness in the skin, formation of substantial edema, and formation of clear blisters that spumate to form black scars. And the third degree is extended into the subdermal plexus and leads to formation of hemorrhagic blisters, skin necrosis, that the skin becomes blue and gray, discoloration of the skin. And the fourth degree is extension into subcutaneous tissue, muscle, bone, and tendon. There is a little edema and no blanching cyanosis. We are example here of how the frostbite is represented in the skin of the person. One is full freezing, which is normal with the color change to blue and gray for cyanosis and some partial edema. Also, frostbite can be divided in 3 zones. Zone of coagulation, this is the most severe and is irreversible. Zone of hyperemia is the most superficial, with at least cellular damage and can recover with treatment. And zone of stasis that is characterized by severe but possible reversible cell damage that can from death with treatment. We have example here of how manifested in the line tissues, and how the fingers and the hands can be change color, can stay the blood. And people exposed to cold temperature for a longer period is a greater risk for frostbite, such as winter sport enthusiasts, military personnel, also people with conditions that impair blood circulation, people that may be diabetes, and for those persons that drink a lot of alcohol, that have a low immune defense in their body. Frostbite is prevented, including avoid temperatures below 15 degrees Celsius, covering the body properly, and avoiding situations that increase heat loss like exhaustion, intoxication, and exacerbation. For treatment and prevention, one of the most important is to discourage smoking. Also remove wet and congested the clothing in the skin. For pain management, start with parenteral antibiotics, clean blister, and amputation is needed in those persons that have a lot of damage in the part of the body. Reconstructive operation if it's necessary.
Hi, my name is Fatima. I will talk about cold-related injury. I will say about hypothermia. Hypothermia is occur in very cold temperature. They can occur in cold temperature too, if a person is wet. Sign symptom in adults is shivering, exhaustion, confusion, memory loss, and drowsiness. And infants can be bright, red, cold skin, and very low energy. Hypothermia. Hypothermia occurs as body temperature falls below 95 Fahrenheit or 35 Celsius and is considered a medical emergency. Conditions that promote hypothermia: cold weather invention, acute injury, hypothyroidism, malnutrition, silent medication as phenodiazinase and barbiturates, and alcohol intoxication and substance abuse. How to assess hypothermia? Hypothermia is divided into three categories by severity. The mild hypothermia is can be like between 90 and 95 Fahrenheit or 32 to 35 Celsius. And manifestation is gonna be shivering, impaired cognition, dysarthria, decreased muscle coordination, and diuresis. Moderate hypothermia can be between 82.4 and 90 Fahrenheit or 28-32 Celsius. Manifestations include muscle weakness, increased local coordination, acute confusion, possible stupor, apathy, and incoherence. And severe hypothermia can be below 82.4 Fahrenheit or below 28 Celsius. The manifestation for severe hypothermia can be decreased pain responsiveness, decreased neurological reflex, decreased respiratory rate, bradycardia, acid-base imbalance, and severe hypotension. The intervention, so we're gonna have first aid, pre-hospital care, shelter for the cold weather, and wet clothing have to be removed. Keep patient warm, passive or active in external rewarming, protect patient from further heat loss, prevent ventricular fibrillation, prevent orthostatic change in blood pressure from cardiovascular instability, and maintain the ABC. The treatment for the people that have hyperthermia can be is that if it's moderate hyperthermia, they're gonna have active external, applying external heat with heating blanket, or core internal rewarming method. So one IV fluid, heated oxygen or inspired gas to prevent further heat loss via respiratory tract. And in severe hypothermia, use extracorporeal rewarming methods such as cardiopulmonary bypass hemodialysis.
Hi, good morning. My name is Anthony. I'm going to be talking about high altitude related illnesses. High altitude illnesses is the exposure to low partial oxygen at high elevations. And it should be elevations over 5,000 feet, and there are risks for hypoxia, and also elevations over 18,000 feet at extreme latitude supplemental oxygen required. Risk factors for high altitude illnesses are obesity, chronic illnesses, cardiovascular diseases, dehydration, central nervous system depressants like alcohol. Acclimatization. Acclimatization refers to the physiologic changes that help the body adapt to less available oxygen. Respiration rate increases, hypoxic ventilation response. Increased respiration rate causes hypocapnia, respiratory alkalosis, REM sleep is impaired. Increase in sympathetic nervous system activity increases heart rate, blood pressure, cardiac output, pulmonary artery pressure, and cerebral blood flow. The three most common clinical conditions that are considered to high altitude illnesses are high altitude cerebral edema, high altitude pulmonary edema, and acute mountain sickness. The assessment for high altitude mountain sickness are throbbing headache, anorexia, nausea, vomiting, feeling chill, irritable, and apathetic. Vital signs are viral.
Hi, my name is Jennifer. I'm going to be talking about high altitude pulmonary edema, okay? It's a serious condition that requires quick evacuation of high altitudes, oxygen administration, and bed rest. Excess fluid develops in the lungs, either in lung tissue itself or in space normally used for gas exchange. This means that they're unable to perform gas exchange properly and cannot get enough oxygen to function normally. Signs and symptoms are chest x-ray indicates pulmonary edema, as you can see in this picture over here. Dry cough, fatigue and weakness, cyanosis of lips and nail bed, arterial blood gas analysis showing alkalosis and hypoxemia, and pneumonia may occur. Crackles may be auscultated on both lung fields. Interventions. Descent to a lower altitude. Patient must be monitored carefully for any evidence of symptoms. Patient should be allowed to rest and not go to higher altitude until symptoms lessen. Oxygen should be administered if available. Prevention and treatment. Use of the oral drug acetazolamide to treat haze. It gets rid of excess fluid and induces metabolic acidosis. Ask about allergies to medication because it contains sulfur. Ensure adequate hydration and nutrition. Avoid alcohol and sleeping pills on high altitudes. Wear sunscreen and goggles or sunglasses. Keep patient warm at all times, and hospital admission is required.
Hello class, my name is Scarlett Bravo, and I will be introducing a mother's worst nightmare, drowning. And up until I did this research, I actually learned that there are a couple of different types of drowning, which I was actually not aware of. Anyhow, I will be explaining the pathophysiology, the assessment, interventions, and how to prevent drowning. Next slide. Now, drowning is the leading cause of accidental deaths. And here is where I mention the different types of drowning. For example, here, near drowning. Near drowning, this is when a person almost died from not being able to breathe, or basically suffocates underwater. For example, someone who falls through thin ice, or even someone who wants to take their own life as a suicidal attempt. Then we have submersion and immersion, which both cause respiratory impairment. An example of submersion occurs a lot with children who are under 5 years old, usually in a pool or bathtub. And of course, when this happens, it looks like it was a negligence. It can also occur to any person older than 5 years old, which I will explain further. And here, in submersion, what I was saying, under a pool or a bathtub would be something like this in these two pictures. And in immersion, this can actually occur, as you see in this picture, where this man's head is immersed in the bucket. And I'm not sure why he's doing that. He could have been under the influence, I don't know what. But this can also happen with a toddler who is being curious and wants to go over the toilet and goes far enough to immerse his head where it lifts his body and cannot find a way to go back down. So the difference again, submersion is when the whole body goes under, immersion is just the head. So those were the two type of different ways of drowning, which again I was not aware of. Go ahead, next slide. And then here, what I wanted to say real quick was I'm sure that everyone in class has played a game once in their lifetime. I know I did. You know that you say, oh, with your friends, oh, let's see how far you can go without catching air from one end to the pool to the other, stuff like that. Well, basically when that happens, you're basically suffocating yourself. Okay, so from what I recall, sometimes I would not make it, and when I would not make it, I would put it in myself in my head, I'm gonna make it all the way to the ending of the pool, but halfway down I can't breathe and I start panicking. Well, that panic, we lose our normal breathing pattern. So when that happens, we begin to hyperventilate, and then because we hyperventilate because we're holding our breath. Oh, and sorry for that. So then what happens is, like I was saying, we begin to hyperventilate. Eventually, when we hyperventilate, we aspirate water because and then we aspirate it. So what happens is it triggers your laryngeal spasm, which blocks airway and protects the lungs, which explains why sometimes crying out for help that you're like, and you can't, it happens because of that same action that I just explained. Then our oxygen supply drops because we cannot get any air, which leads to hypoxia, making us unconscious, relaxing our airway lungs to fill with water. And that's what happens. We fill with water because our airway, we relax our airway, we relax it, and then that allows the water to go in. Sorry about that. Okay, so next in assessment, we want to know the quantity and makeup of water aspirated, meaning what was it, fresh or salt water? And this is important for several reasons, because aspirating both fresh and salt water causes surfactant to wash out of the lungs. And if we can recall, surfactant is that little mucus, little fluid that we have on our lungs, and it reduces basically surface tension. So that's why when we don't have that, we can have problems within the alveoli. It increases lung compliance, and then so the loss of that destabilizes the alveoli and leads to increased resistance, which can lead to a collapsed lung and hypoxemia, which you'll see there. And then in salt water, it is hypertonic to the blood. So plasma gets sucked in and prevents gas exchange in the alveoli. And when there is no gas exchange, there is no air, there is no oxygen. So this buildup in the sacs stops oxygen from reaching the blood. Essentially, you are drowning in your own fluids. So in fresh water, it is hypotonic to the blood, diluting our plasma and electrolytes, quickly causing blood cells to swell and burst. The water will prevent body from taking oxygen, which can lead to cardiac arrest. In both cases, pulmonary edema results in similar degrees and lung injury occur. Now, water quality, which I said it was quantity makeup, water quality, hypoxia, causes of drowning, which those are the assessments that you need to find out. I'm just getting into the details of that. So for water quality, this is important because the outcome could be negatively affected by the contaminants in the water, such as chemicals, algae, microbes, sand, mud. All these can worsen the injury to the lungs, causing lung infection. And as for hypoxia, in the assessment, knowing the duration and severity is also very important because it has been reported that very cold water seems to have a protective effect, such as hypothermia and diving reflex, which I listed there, with successful resuscitation, even after prolonged arrest intervals. And hypothermia offers protection by reducing cerebral metabolic rate. And the diving reflex is a physiologic response to asphyxia, which is being deprived of oxygen, causing suffocation, which produces bradycardiac and vasoconstriction of vessels in the intestines, skeletal muscles, and kidneys. This effect is thought to reduce myocardial oxygen use and enhance blood flow to the heart and cerebral tissues. These two together is often cited as a big reason why some young children have been able to actually survive drowning after being underwater for more than 10 minutes. And this is a big deal because the likelihood of survival with little to no brain injury damage is very low after 10 minutes. And of course, the cause of drowning, basically, we all know if we suffer a medical condition, like if we have a medical condition that alters us from actually knowing how to, at that moment we forget how to drown, something happens, we have a seizure, a myocardial infarction, a stroke, a spinal cord injury can also happen. A good example is what I put here, injuries such as diving. You can easily go and hit your back with a rock, or something can happen, an injury can happen that can actually cause from any of these injuries can cause drowning. And risky behavior, which is here, jumping out of a hill or mountain or whatever you want to call that. Those are risky behaviors, especially people usually that do that are under the influence. They're, having a wild time, partying, so on and so forth. So they go and they do things like that. So next slide. And next, interventions. Okay, here we have first, there's two interventions, first aid emergency and hospital care. For first aid emergency, safety due to hazards, spine stabilization, for example, a board flotation device would fall under a spine stabilization. Airway, which you'll see, I think there, no, I did not. Well, this right here you will see, this would be a spine stabilization as well. What else? And airway clearance and ventilator support, which you see that they're doing there. And you'll see that they're giving breaths while the victim is still in the water, which is right here. This is also something that can occur, like if the patient is in the water, they'll also do they can also do the clearance here, not just outside the water, which I found that interesting. I didn't know that you can also perform that inside the water. Now for hospital care, GI decompressions, gastric decompressions, which is the typical CPR, stuff like that, and the NG tubing, which you see here in the oral gastric tubing. And basically that, it just improves ventilator function. And I also want, let me see, I believe that's all that I wanted to say with that. But I want to also add that for hypothermia, an average person cannot expect to survive more than 3 hours of immersion in midwinter. And because there are two positions that can be done to help. Heat escape, lessening position, huddle position, which both combats hypothermia and help reduce the heat loss while immersed in cold water. Next slide. And that is it. What I wanted to, this is just a picture which I wanted to include as part of interventions and preventions. These are the two main positions that I read about that would actually help with hypothermia. Like, see this here, it allows, like if you're cold, it allows for you to, your own body to create the heat, as well as here, if you're in with more than one person, you can do like a huddle position, which that also helps a patient who's going through hypothermia and the water's too cold. Okay. And I explained the preventions here. Observe area and signs. Obviously, you want to see what's around. Do not swim alone. If you know, obviously, you need to know your own swimming ability. So, if you know that you're not too well in swimming, do not swim alone. Test the water depth before diving. Make sure that it's not too deep. That way, you know how far or close you need to stay by the bank. Avoid alcohol beverages. Obviously, alcohol, messes with your, with where you are. You lose consciousness, and anything can happen. Life jackets, flotation devices, and rope on site just in case anything happens. Here you see the life jackets. Sorry, not the life jackets, but the flotation device. Here, inform parent about swimming lessons. This is actually this is a good nursing intervention or nursing teaching, because aquatics.com is another, they're a facility where they train or help little babies to toddlers how to swim. So you can inform a parent that most parents aren't aware of this, and this would actually be a prevention because you're putting your baby in swimming lessons. Next slide. And that is it. And this is just a question we put, which you will see the answer on the next slide as well, and you can look at that afterwards. Thank you very much, class.